Hi everyone, my name is Shweta and I'm going to be talking about the American Cancer Society and how it aims to promote public health in the United States. The mission and impact of the American Cancer Society is to promote healthy lifestyles in order to help prevent cancer, to research cancer and its causes to find more answers and better treatments, to fight for life-saving policy changes, and to provide everything from emotional support to the latest cancer information for those who have been touched by cancer. There is an unequal burden of cancer across the U.S. population. So, for example, people who don't have health insurance are more likely to develop cancer and die from it than the general U.S. population. The American Cancer Society's Health Systems Initiatives addresses the unequal burden of cancer by reaching individuals in underserved communities to promote health equity and ensure equal access to cancer education and screenings for everyone. The American Cancer Society also has a change program which works by awarding grants in order to promote health equity and access to screening resources within underserved communities. Many of their programs and services have been developed to reach diverse audiences and provide greater access to care, and these include rides to treatments, a place to stay during treatment, and help navigating the healthcare system. Their website also offers reliable and accurate information and news and programs and services nearby. Does the American Cancer Society have any focus specifically on groups such as racial and ethnic minorities? The answer is yes. Um, Studies have shown that although breast cancer death rates have decreased since 1989, not all women have benefited equally from these advances. In fact, in the most recent period, Black women had a breast cancer death rate that was 40% higher than white women, despite having historically lower incidence rates. And for Black women under 50, the death rate is double that of white women. These studies show that members of racial and ethnic minority groups, as well as people with low socioeconomic status, have worse cancer outcomes for a variety of reasons. These include access to healthcare, lifestyle factors, and genetic differences. And the more that these factors can be studied and understood, the American Cancer Society believes that the more effectively they can be addressed. And so the American Cancer Society conducts and supports research to help understand cancer inequalities and create strategies for overcoming them. In the LGBTQ community, studies have shown that they have an increased risk of cancer. And this is because, as a group, they smoke more, drink more, have greater rates of obesity, they are less likely to be up to date on their cancer screenings and less likely to have health insurance. They report lower satisfaction with cancer treatment and higher rates of feeling discriminated against in healthcare settings than other populations. The American Cancer Society is defining a new program in partnership with the LGBTQ community in order to help understand and reduce disparities in cancer, risk factors, and outcomes. They also have specific public health and research programs that are targeted at reducing cancer-related health disparities for the LGBTQ population. The American Cancer Society also helps support the homeless because they offer them a place to stay while they are undergoing treatment. These places are called Hope Lodges, and there are more than 30 Hope Lodge locations throughout the United States and Puerto Rico. These are completely free of charge, and any patients that are older than 18 are allowed to stay in them. The mentally ill is supported by the American Cancer Society because they acknowledge the fact that cancer can have a toll on your mental health. They have a team of experts that offer the patient and their family support during their difficult cancer periods. And this is my works cited page.